to me, Africa.
Thank you so much, ladies, for coming to talk to me, Africa. Today, I'm so excited to have Maflo. I call her Maflo, but she is Florence Njoyi. She is a licensed independent clinical social worker and also a doctoral candidate for behavioral health. Thank you. I'll call her Maflo for the respect given to us or expected of us in our African culture. Maflo, welcome back to Talk to Me, Africa.
Thank you very much, and thank you for the opportunity. Thank you for the opportunity to educate the community about mental health and mental illness. And I really, really appreciate coming back to the show to talk about mental health and mental illness in our community.
Thank you so much. And Dr. Vivian Gongang Ogoniyemi, correct, right? You are a doctor in nursing practice. Thank you so much for coming back to Talk to Me, Africa.
Thank you for having me on. Looking forward for a discussion and mental health, especially in our African community. So I love it. Thank you.
Thank you. And joining us all the way from Europe, Patience Abonge. I am so glad to connect with you today. Patience is a support worker working with people with learning disabilities, and she is going to be talking today representing people challenged with mental illness. Patience, I'm so blessed to have you on Talk to Me Africa. Welcome. Can you hear me, Patience?
I didn't hear you from the start. I could hear you, but I think I didn't get the last things you said. It was breaking.
Welcome to Talk to Me Africa.
Thank you very much for having me on your show. It's a pleasure to be able to have this community where I can share my story, because putting my story out there was my intention, to reach out to many more people suffering in mental illness, because I realized that it's something that it's so common in the society, especially our African communities, where we don't have the resources and we are not really informed about the help and how to support someone suffering from a mental illness.
Mm-hmm. Wow. Thank you so much for putting your story out there. I must say that, full disclosure, I found you on Facebook. I follow you on social media. You were so vocal about being challenged with mental health. Really appreciate you coming out to talk about it, because our African community need to hear more about this. So having you here is a real pleasure, and it's going to be a lot of information passed out to our African community. But before we get into the depth of your story, let me ask Dr. Vivian Gongang, tell us a little bit the difference between mental health and mental illness for those who don't know.
Yeah, absolutely. Good question. So we kind of talked about this in our last video. So if someone watched that video, you definitely want to go back and watch that. But our mental health is overall our well-being, right? Like just even your sleep. How are you exercising? How's your relationships with people in your life? How are you taking care of yourself, both inside and out? How is even your finances, right? Because your finances can impact your mental health and your mental well-being. So mental health is just kind of your overall general wellness and state of relationships, the peace, the joy, the happiness that you have, and how you're going about getting that. And then when we talk about mental illness, that's where we see where there's sometimes an imbalance in certain neurotransmitters in our brain, genetic factor or environmental things that occur that causes you to maybe have, whether we call depression, anxiety. We can break it down to even like the bipolar and different forms of mental illness that occur. So mental, health is your well-being, your wellness. And then we see mental illness where we see a breakdown in your wellness, where it causes a disorder such as depression, bipolar, and the list goes on.
I know on the previous show, when you and Maflo were here, we talked a lot about the medical aspects of mental illness. Today, we'd like to focus more on the community, the family, and who's affected, and what resources we have out there for those of us in African communities who have such challenges. Maflo will talk a lot more about that because she's such a community person, but I want us to listen to Patience, first of all, who is here today as a person challenged with mental illness. Tell us your story, Patience. Let's listen to you.
My name is Patience Abonge, and I'm a mom of two amazing kids, a boy and a girl. And my first son is autistic. He's 9 years old. I am based in the UK and I am a support worker. I work with the elderly who suffer with learning disabilities like autism, like my son, and Down syndrome and other disabilities. I've been in a mental institution 3 good times. That is in 2016 and in 2018, and my last relapse was in July of this year. So it's basically like 2 months that I left the mental institution again, or less than 2 months, I'd say. So mental illness or mental health, like the doctor just said, is something that we don't take seriously in our community, including myself before then. So I didn't know what mental health or how I could take care of myself generally to help myself go through a lot of issues. Because the first time I was affected, which was in 2016, like I said, my son was autistic. Now that I read a lot about mental illness and try to get a lot of information online to educate myself, to know exactly where and what the problem could be, why I went into a hospital the first time and the second time and the third time, and how I'm picking myself up, it's from informations and videos that I watch online to help myself. And I have learned a lot that I decided to put my story out there in May. And unfortunately, or I'll say fortunately, I went back to hospital and came back stronger than I went in the first 2 times. So in 2016, my son was born in 2012. And when I realized he was autistic, before then, I was born and like I don't know my story from 0 to 3, to be very honest, because if I'm telling my story, I need to be honest. I don't know my story from 0 to 3. Like I lived with different aunties and different family members, and I think growing up in that environment or in that way really affected me mentally, because you know how African communities are growing with aunties, and no matter how much they love you, you still have that void where you think, oh, this is not my mother, this is not my, I wish I had my mother, I wish I had my own sisters, cousins. And so all of that was affecting me. And because I was numbing that pain, or in Africa, we are taught to just,
Tie
grow
hat.
out
They
of
say
it.
tie hat.
Tie hat.
Cover it. Numb it.
Cover
Bandage
it up. So yeah. So I had issues like I don't even know my dad right up to this point. My mother was not in my life. I didn't grow up with my mother. I grew up with her sisters and finally with my grandmother. And they gave me the love that they gave me at the time the best way they could, because that is exactly what, like I said, I've been educating myself to get to a point where I have to realize that whatever thing any person did to me was not out of hate, but out of how they themselves were being treated. So I take that for the love that they had for me, even though some of those treatments really affected me psychologically and leave the trauma in me that I grew up as an adult. Those traumas were unresolved, and travel to a country. Everyone, I think all of us on the show is out of Cameroon, where I'm in a country where you don't have that support, you don't have that family around you. And I had my first son, he's autistic. I'm depressed, but I didn't know I was depressed at the time. I didn't know what to call it, but I just realized that since he's autistic, I'm ashamed. I couldn't talk about it to people. I couldn't even tell my community that my son was autistic because of the shame and the taboo stigma around autism. So dealing with that alone was just too much for me. And the time I realized he was autistic, I was pregnant with my daughter as well. And so, like I said, I was depressed, but I didn't know what to call it. And then in 2016, my husband is in the army. And so we moved from Germany to the UK. And in 2016, the suppression of the trauma growing up, and now my first son is autistic, I'm thinking to myself, oh, I start blaming myself, like, why me, why God, why me, and all those things. So I sat there crying behind closed doors, and no one will even see me cry. But I'll come out because everyone know me as this jovial and happy person. But I had this side of me that no one knew or no one was saying. And so I was breaking behind closed doors, but I'll come out laughing and so nobody could see that pain. And in 2016, I got to a point where, you know, I went back to my family members and said, and I started asking a lot of questions, like, who is my dad? Jason, can you bring down the volume, please? Thank you, Papa. Who is my dad? And so I started asking a lot of questions in the family where, you know, adults in our community, in our African society, we cannot question them. And so aunties were not happy with me, cousins were not happy with me, and a lot of people cut off me right up to this point. It's about 4 years or 5 years now. And that was the immediate trigger of my first mental illness. That cut off from the family where no one wanted to listen to me. Like, who am I to question them? Who am I to talk to their mother in that way? Who am I to, you know, yeah, well, mommy don't help you, those kind of things. Like, we have done all of this for you, and you get up to question us. But I needed closure. I needed to have these answers and get closure. But I think up to this point, they've still not gotten it, where I've just moved on. And I said, what I know is when I move on, things will fall in place. Some are already falling in place because the people are now realizing that, oh, maybe this could be the reason, and the reason why I've been in a mental institution. So the major trigger in 2016 was that my family cut me off, including all my traumas growing up and my son and all of that. But that immediate trigger, what pushed me into hospital, was me not having support from anyone whatsoever. And I found myself in hospital. The first time I went in hospital, like I said, I didn't even know what mental illness was all about. It was strange to me. And so when I went in hospital, this is an environment that I didn't even know I was in hospital because of the tranquilizers. You're a mental health nurse. There's mental health nurse, you know, those tranquilizers that you get. It has a way it affects me, the patient. I'll speak for myself. So it took me days to realize that, I think even almost weeks to realize that I was in hospital. And when I realized that I was in hospital, and this is strange not only to me, but to everyone around me, and they don't even know how to help me. And I'm frustrated in the institution, and then finally left hospital. And the support, I like I said, every reaction from the people that I felt at the time did not give me the support that I needed. Now I've come to realize that it's not because they didn't want to give me, but it's because they didn't know how to support me the right way, or the kind of support to give me, because it wasn't only new to me, but new to everyone around me as well. And in 2018, when I left hospital, the medications I took, because I am someone who was really working, doing like fitness for my mental health, and I like to stay fit. How I look is very important to me. And the medications that I took at the time really made me to put on weight. So I left from a UK size 8 in less than a month, and I went to a size 16. So that alone, in addition to my mental illness and how I look, which is something that's very depressing to me, did not help me at the time. So it took me almost 2 years to get out of depression. So I was depressed, like really depressed, where I couldn't even cook or have a shower for myself and things like that. And in 2018, by then I had walked out and gotten back again to myself, to my life, my happy self. And I don't think there was really an immediate cause, but there were a lot of things going on in my life that I might not like to share, maybe some other time in the future, that were going on in my life at the time. That was the immediate trigger as well, that I said I would not like to share that on air now, maybe some other time. So there was another immediate trigger. What I'm trying to make people understand is, I am depressed. Like, for instance, my son's illness and other issues make me depressed, but there was something that would push you to that lead me to the hospital. Because what I tell my friends is, a lot of people suffer from depression. The difference between me and someone who doesn't go in hospital is that you have the support. Maybe you have a problem, but you have a family member to speak to. You have your sister, your mother, your husband, you have someone to talk to. But I was lacking. I didn't have that support where, you have this problem, you have this person to talk to. I keep it all within me, and bearing all of that doesn't help me. And then they become an immediate trigger that will push me now to go into hospital. And then there is support. Where I go in hospital, I still don't get the support, because that is why I'm putting my story out here, just in case someone, because even this last time that I went into hospital, someone contacted me and I told her, your family member can get out of that hospital even under 72 hours, 72 hours or 14 hours. If you're not aware, you'll be in there for 28 days. That's the UK. In the UK, I don't know about America. So in 2018, I was in hospital again for another 1 month. And then this last episode, I put out my story in May to start telling my story to help the community. And then in July, I had a lot going on, just too much. And the difference between now and the 2 other episodes, I could realize when I was becoming psychotic, because I've been psychotic 4 times. One of the 3 times is when I went into hospital, but there's been a time when I've been psychotic during the COVID time. And the only reason why I didn't find myself in hospital at that time was because of the COVID, which is again to tell you that if you know how to support someone, even though you're psychotic at home, you can help your family member not to go into hospital, not to push them to that extreme whereby they find themselves in hospital. I've been psychotic and I was home for about 5 days hallucinating and not making sense. But I survived that at home because of the COVID. So, we were scared, or people around me were scared of the COVID, and I survived that. So that's an example to say, oh, you can help someone at home if you know the right support and how to help them not to go very critical or end up in hospital. Because once you find yourself, or once I find myself in hospital, I know they're out there to help me, but again, most of the people in the UK, I don't know America, are Black people working in the mental institutions. And because we don't know about mental illness, the patients, or I suffered a lot, especially in the hands of our Black communities. And that is why I put out my story here, not only for family members, but equally for professionals as well, especially the Black community. That's why I specify the Black community. The 3 times I've been in hospital, most of my care was in the hands of Black mental health nurses, where I think their care, even the other day I was speaking to a friend who is a mental health nurse, and she said this to me. She wasn't trained, that she was only trained to restrain patients and call the big guys when someone is aggressive. And that really got me, I'll not say pissed off, but I didn't feel comfortable with that, because that is really practical in the mental institutions. Because what she told me is exactly what happened. She said we were not taught about the care. The care is left with for the clinicians and the doctors. And you only see them sometimes once in 2 weeks, once in 1 week. So they are there where they're supposed to teach them how to care about us, but they don't give us that care. They are only there to restrain us if there is an aggression. And that really made me to feel bad. And I was like, I have to make a separate video about this. So my last episode was in July, where and I've managed to pick up myself, because the last time when I was in hospital, I realized that I was in hospital. Even though I was in hospital, I was so positive, and even the nurses were surprised and said, this is the first patient that have taken them by surprise at how I have picked up myself, even in there. So yeah.
Wow.
It's a lot to take in, patience. Wow. It's a wow, like Maflo just said, it's a lot to take in. You've addressed a lot. And sharing your story, I just can't even talk after listening to her, how open and vulnerable she's made herself. The community is really involved in this, in a good or a bad way. You've talked about growing up, about COVID, about how we have our own kind of people in the mental institutions, but they cannot help you because people always say, I want my own kind, right, doctor? When I go to the doctor, I want my own kind so they can understand me better. It's a lot to address here today. Before we get into that meat of it, let me talk to Dr. Vivian. Is there a relationship between growing up and mental illness?
Oh, absolutely.
Let me just interject a minute. The patient story has been really, really deep. Let's do some debriefing. Just sit, relax. Take one deep breath in, out. In, out. Relax on your seat. Take your body if you can. Breathe out the tiredness. Breathe in the energy. And out the positiveness. Let's continue.
Thank you. Thank you for that. All right, Vivian, Dr. Vivian.
Yeah, so patients, I hear your story and I see it a lot, and you are definitely not alone. Even in the white community, it's the same thing. In our African community, it's present. And what makes it really hard for our African community, just like what you said, is we're taught to suppress, right? Taught not to ask questions. We're taught to just listen to whatever people tell us. The trauma that we go through as Africans, not knowing who our family is, not having the social support, being in an environment where the economic system is not the best, childhood abuse, rape, all those things add up and can trigger a mental illness, especially when we don't have that support to manage and process those things as kids and as adults. It will build and pile up and will trigger mental illness in our lives. So trauma is one of the key things that will trigger a mental health episode. So you're not alone. It's prevalent, and I think that it's unfortunate that our community will silence us. Questions. When we ask questions, that's where we get to have answers, and it gives us some kind of closure. Patients are really like what you said, right? Sometimes we're looking for that closure from places that we can't get it from, right?
Yeah.
Realize that people will do their best to what they know. Like we will come from this place of anger until we realize that they're also coming from a place where they don't know, right?
They don't know.
So when we look at it from that lens, we're not saying their action is okay, but we give a better understanding to why they did what they did, and we can now form our own closure, whatever that means for us, so that we can move forward. Because when we keep going back to ask the people who can't give us any answers, it keeps taking us back into that revolving cycle, right? So knowing that they don't know enough to give me what I need is also some form of closure, because we can say, I need to create my own closure, although it's really hard, and to process that trauma in whatever way possible that may look for me. And I think, like what you talked about, the hospital setting, a lot of people are trained to manage people when they have a psychosis, and it's to isolate them, right? Put you in isolation, put you in 4-point restraint, and that's really it. They give you your medication, and if you're acting up, they put you in restraint, or they put you in an isolation room, which does not help in your care at all. So a change needs to happen in the way, that's managed. And I think in the community, at least in the US, they're trying to form more community-based mental treatment places, so that you don't have to go directly into the hospital, avoid some of those kind of treatments. So depending on your severity. But thank you so much for sharing your story, and you are not alone, and I absolutely get it. So
yeah, we needed that deep breath, like Maflo directed. So let's talk to Maflo about the people who are affected in the family when there's somebody that is challenged with mental health illness. In the previous show where you and Maflo, talking to Dr. Vivian and Maflo were here, Maflo was so open and had videos, slideshows of her sister who had been challenged with mental health illness. So Maflo, how does that affect family members?
Wow. Thank you very much for bringing me again the second time in the show. And thank you, patients, for your wonderful, wonderful story. I got also touched about the story because that was how my sister experienced the mental illness. And that's how my family responded to her illness, and the community and the society as a whole. So your story is just a replicate of what many Africans, Cameroonians in particular, are going through in their community and in their families. I know of a couple of these in America here, when they get individuals who are sick in their community or in their home, the highest thing they do is either they lock them in the room or they send them back to Cameroon. And I tell them that is not right. We need to, first of all, accept the situation that it is a disease, like diabetes, like high blood, like cancer. When your family member has cancer, you pamper, you feed well, you emotionally support. But when they start exhibiting psychosis, then they start saying, go where you brought that illness.
Oh my God. Yeah.
They didn't bring it from somewhere. It's like Dr. Vivian said, it's either from your chemistry of your body or from the environment or from the society that triggers some of those conditions that leads to psychosis. Vivian's story brought up a lot of stuff that we need to talk about in our community.
Patient story, you mean?
Patient story brought a lot of situations that we need to start talking. The one I got first was postpartum depression. He had her son and was depressed, and nobody noticed it. What do we do in a community when our women get through pregnancy with depression? After delivery, they have this postpartum depression, and her own went right to psychosis. The first thing that I would say, like a clinician, like a community person, is that acceptance. Acceptance of that person. Acceptance of the condition. And now the world is so open, it's a one global village. So you can actually ask questions, Google things, and even talk to somebody using telehealth. If you have the stigma of going to the clinic, call your nurse to say, my family member is experiencing this. What can we do? What is all about? Learn about it. The more you learn, the more you understand, the more you accept, and the more you are able to manage the condition. He has talked about being in the mental institution. Nowadays, we are moving away from that word or those words because it's actually bringing up the huge stigma that we have in our community. It is just a hospital. Let's talk about our people going to the hospital, although they are going for psychiatric care, but they are going to the hospital. When you are in the hospital for cancer, do they say you are in the cancer hospital? When you are going in for diabetes, do they say you are in diabetic hospital?
You're going to the hospital, period.
You are going to the hospital. So let's start talking about those places, those things related to mental illness treatment and management in that positive tone, like any other disease. Coming back to the community, patients actually talk a lot about triggers.
Yeah.
There is a lot of triggers in our family cycles, then in the community, then in the society. For example, the case of my sister, the trigger was always in the family because they will say, come on here, go there, crazy woman. When you label that person who is sick, even though they are experiencing psychosis at that time, we give them some time to actually think straight like you and me, we are thinking. And when you give them labels that time, what are you expecting that person to be emotional at that time?
Exactly.
That's why
let me chip in something here, because I was labeled, I was called mad, I was told I deserve to be in a mental institution. And what I experienced at this time is because you've already made me to hate you. Psychosis is me hallucinating, it's me being superstitious. So you creating a relationship of hate between yourself and me helps or doesn't help, because the images that I'll build in my head or the images that come to my head the things I say is based on how my relationship with you at the time.
Mm-hmm.
Because after hospital, my friends or people around me expect me.
We're having a little internet disconnect right there with patients, but I'm sure it'll pick up again. I'm really taking all this in, and I'm getting whelmed by this. Patients, go ahead. We lost you a little bit. Continue.
Yeah, so I don't even know where I stopped. I'll just go over again.
Mm-hmm.
What I'm saying is, my relationship with anyone when I'm psychotic, because when you're psychotic, or when I am psychotic, don't speak for myself, you're partly conscious and partly unconscious.
Mm-hmm.
Meaning, I can make sense of my environment. I know everything I said. I know how I be. I might have forgotten some, but we remember those stories. Be it how filthy, I'll put it, or how bad the behavior was. And that is one of the reasons, because I spoke with a friend that I created in the hospital, and she was like, I'm ashamed of all the things that I did. Fortunately, this last time I was in hospital, I was 80% or 70% conscious than my two previous experiences. And there's a reason for that consciousness as well. So I could see exactly what she was doing. I know exactly what she was doing. I was like, darling, you don't even know anybody in that hospital. So don't care. Don't care. You were ill, and that's on the period. So that's telling you reasons why people might not even want to talk about their illness once they recover. Because I remember everything I did even in 2018. I know those stories. You would say, oh, I walked naked. Yes, I remember those things. I remember. But why? What happened is the relationship between the person trying to give me help at the time. Because the relationship, even with the support workers, I know you're coming to restrain me. How will I behave towards that? That will only make me to become more violent, because what you're doing to me is practically not right. Because you think I have lost my mind. No, I am not. I am partly conscious and partly not conscious. So there's a thin line where workers don't know that we are conscious about these things, because the workers, I will really talk a lot about the institution, because I've been in there 3 times and I really know what goes in there. The workers are just ready for you to just react, and then they just come and restrain you, which is really bad, because I feel like it's dehumanizing, because I know why I am violent. I'll put it in quotes as they put it outrightly. I know there is a reason why I am behaving, and what I expect from you is for you to listen. Give me a listening ear for me to talk and explain myself to you. And once you ignore me, because they don't even come and sit there
and talk to you.
Yeah, that's really the point where I was going to, where community members and family members need to listen to those their members that are sick, because they have something to say. Even they babble, even they mix up what they are saying, you pick up something from there that you could talk about. The listening part, after accepting the situation, you have to listen. Like a family member that has gone through this, myself, I do think that I was also traumatized being in that situation where my sister is actually sick. You know, being traumatized is also my own mental illness too, that I have to manage. Somebody needs to listen. When you start listening, you are able to start advocating, start providing that support that is needed, and start accepting the situation that this person is sick and he needs that support, he needs that help, and I actually need that bonding to say this person is human, it's not an animal. You know, my sister's experience is that I say every time in Africa, in Cameroon in particular, they throw stones after her.
Yeah.
They fed her with dirt. Some people actually tore dresses from her and stole it. That this mad woman, why are you wearing this beautiful dress?
Someone asked me that in hospital.
Someone asked you that in the hospital, patients?
Yeah, I was dressed up one morning going for breakfast, and this support worker was like, why are you well dressed too? And that was now a trigger, and it pissed me off to the point where, they'll go and put it in the notes that I was aggressive. But they don't put down the questions coming from their support worker. How do you ask me that kind of a question? So my response to that, why are you beautifully dressed to come and take care of us as well? Why do you have to ask me such a question? How are we supposed to dress in here? How are the patients supposed to? Because my intent or my goal in that hospital was dressing to, I don't care if I was in a fancy dress in that hospital. I was just like I think to them I was like a drama queen. But because they think I've lost it, but I was like, no, my positive outlook in here is how I'll save myself out of this place.
So thank you very much for talking about that. And as a community person, I encourage all of us in one way or the other to pick up triggers that trigger our individuals before they could get up to severity. When you pick up that triggers and you address it, you are helping that person to manage that condition. It's just the same like with diabetes. I talk a lot about diabetes because it is in my family.
And it's common. Yeah.
And it's common. So with diabetes, you know that when you eat 4 fufu bundles in one time, your blood sugar will be up. Why allow your loved one to do that?
Exactly.
Talk about it.
Exactly.
Okay. So with mental illness too, she talked a lot about triggers. And triggers come from us. I was in a community organization last week, and there in that one, in that organization, this particular person
2021
went to take food.
Let me see. Show me.
Went to take food to eat. I mean, food that is an abundance. And this person just simply said, why do you take a lot of food like a mad woman? I'm like, really? What are you thinking? Why are you relating to this person like a bad woman or a mad woman?
Yeah.
Therefore, by implication, this person, truly speaking, was struggling with some mild symptoms of depression. And all of a sudden, this person isolated, withdrew. And he just left the food there and left the place. And I called this person after to say, why did you leave your food? And he said, Maflo, you don't even know how that saying entered my heart, that people don't even need me. People don't even love me. People don't even care. But again, that was something that just came out of your mouth and referring to stigmatizing madness, as we call it in Africa. You are stigmatizing it. So this person being sick, I called this person and he said, Maflo, it's only you who can call to find out what happened. How many of us do call to check on our loved ones?
How many? Yeah.
How many of us do listen to them when they say, I'm not feeling good? I am just being in my room that is comfortable for me. This TV thing that I'm watching, I don't even like this news thing. How is it triggering them?
Instead, we isolate them because when we hear that, oh, patient was in the hospital, psychiatric, we're like, oh, no, you can't go close to her. That's how our culture has trained us. And we need to get away from that. Exactly. But I'd like to piggyback from what patients and Maflo have said about triggers and also listening to the patients and address you, Dr. Vivian. How much of listening are you trained to do as a provider?
Honestly, our entire assessment, diagnosis, what we decide to prescribe is based off of everything that the patient tells us. So unlike other practices, let's say you have diabetes, you can run an A1C lab and see like, okay, this indicates you have diabetes, right? So the labs that we can run to say you have diabetes, you have hypertension, because I can check your blood pressure and your number is this and your other number is this, right? With mental health illness, what we get our information from is what the patient tells us. So listening is a big factor in this profession. So it's unfortunate that sometimes we run into people who don't listen, who don't take the time to take care of their patients. They should, because listening to what the patient says is key to how we treat them, how we diagnose them, and the kind of medications we choose to prescribe for them. So listening is a big factor. And I'm sorry that you've experienced that where people haven't listened, and I think that unfortunately the way that some people are trained is to not listen, because we have to meet a certain, okay, you need to see this patient in about 20 minutes and then you have to move on to the next patient. So the system around that needs to be changed too as well, so we can give ample time to listen to the patients when they do come in.
But the support providers, the ones who are there to monitor the people challenged with mental illness and to restrain them when that happens, do they also have this training to listen? Because it starts with them. She's dressed up to go eat, and someone says, "Why are you so dressed up?" That's not a DNP. It's not your direct co-worker. It's somebody who is subordinate to you, who's just there to restrain them. Are those people really trained that way to listen as well?
They're not really trained to listen, to be honest. I was in that role too before. A lot of our training is to prescribe,
restrain.
To give out medications when it's time for them to receive medications. Just kind of assess, what do they do on a day-to-day? Maybe stress funky. Why is that? Is she having a little bit of a psychosis, right? So that's where the training will go. And how do we protect ourselves if something happens, where a behavioral thing happens, right? We restrain, we isolate. So a lot of the training on the nurses aspect is really just to give medications and to isolate or restrain to protect themselves. That's mainly it. There are some times where they have therapeutic sessions where they'll have some activities, but a lot of that is not necessarily catered to.
Yeah, like the therapeutic sessions. What I say is, how do you give therapy to someone who is psychotic?
Yeah.
How do you expect me to go and do personal care? How do you expect me to do my nails when I'm psychotic? Yeah. So to me, I think they should replace that. Therapy is very good when someone is. That therapy should follow in the community when you've left hospital during your recovery period. When we realize that, okay, you're now getting well, let's do the therapy. It will help you to recover. But when you are in a psychotic state, they expect you while in hospital to do exercise. I find that it didn't make sense, because there's a gym in the hospital. You've overdosed me with tranquilizers, and then you expect me to be in the gym to exercise. You tick the boxes, you tick the books. What you said about listening is very and listening from the patient is what has helped me this third time. Because when I realized, first of all, I didn't want to go to hospital, because not because hospital is a bad place, it's a good thing. Once the care and the way the training and the people in there realize that patients will come to hospital willingly if they had the right care from the hospital. But because I know better, even if I find myself again in hospital, I think I will still use the same strategy that I used the third time. Because first of all, my medication was the first thing that I talked to the clinician about. Don't give me this medication. Don't give me this medication for this reason, for this reason. I need a medication that's going to keep me calm, not a medication that is going to make me drowsy. And they're like, what do you mean? I say exactly what I mean. If you give me any medication that will make me drowsy. But when you go in there as a first-time patient, like I went the first time, I know nothing.
You just take everything.
I want to think they know the medications that will work and will not work. Yes, it might work with someone and not work for another person. But I think there's a majority of people that may or might have turned down a particular medication. Because honestly, I have pictures that I've even shared on my Facebook. If you saw me 1 month, I'm not exaggerating. I was in hospital in November and left before Christmas. The difference from a size 8 to a 16 was too much. And it's because of the medications I was taking that made me to eat a lot and become so big. So because they listened to me this time around, they gave me the right medication. They gave me the medication that I asked for that helped me to feel better. But again, I was restrained because they didn't listen to me. I was overdosed because they didn't listen to me. They didn't stick to listen to know why I was reacting the way I was reacting. So the treatment that I got from the third time, I got the right medication, but I got the worst treatment from this last hospital because I went to 3 different hospitals. The last hospital I went to, the treatment was really horrible, to be honest.
Wow, patient, thank you for bringing up that about medication, side effects, advocacy for yourself. Your education about what your condition is and the medication you take is really, really important.
Very important.
Now in America, nowadays in America, they do have what we call community-based services. And these community-based services, we are trying to do a patient-centered intervention. So when you leave the hospital, like you said, you come to the community, you follow up those activities in the community. And you know that sometimes they will say the benefits outweighs the side effects. with psychotic medication, usually they look at the benefits. Is the benefits up to 75%? If the answer is yes, they will give it to manage those psychosis. But again, and start managing the side effects. That is a problem that we have in our community. Talking from a community point of view or family point of view, they always think that when you go to the hospital, they will have to make you a zombie. And that particular idea in our community makes many people not to even seek treatment because they are afraid to be a zombie. But I will say it loud and clear that sometimes psychotic medicines, the benefit outweighs the side effects. And Dr. Vivian will testify that even the side effect is there, they can use another medicine to manage it. For example, my sister was taking a dog. It's an old psychotic medication. Sometimes in America, they don't even give it again. It's not even prescribed, but that is first-line treatment in Cameroon, which is medication that is no more used in America. But again, that particular medicine will give you TD. Tactic, they call it what Dr. Vivian?
Dyskinesia,
dyskinesia. Which means that your face, your hands, your body could shake and all those type of stuff. But again, it manages the psychosis. Okay, the medicine manages the psychosis and it will give something now to manage the TD. But what I'm trying to say is that please, family members, community members, don't discourage people who are sick to go to the hospital to get enough assessment, enough diagnosis, and make a very good treatment plan to help you manage your condition. And with managing mental illness symptoms, you always have options. You can either do medication plus psychotherapy, medication, or psychotherapy and medication. All these options you have it. And patients actually really said it well. She advocated for yourself.
Herself, yes. I was going to go
and
to
that's
that.
why we talked about when you are working with your provider, be it the psychiatrist, the therapist, the primary care doctor, the community team members, you have to advocate for yourself. If you are at that level where you are not able to advocate for yourself, let your family member advocate for yourself.
For you.
That's why they are bringing family members now into the treatment care. That's why they are bringing not only family members, community leaders into the treatment care. So now in my county here, where I am in Ramsey County, we'll have what is called the cultural healers or the cultural liaisons or the cultural brokers, where they'll call me and ask, oh, we have this person from West Africa. How are we going to plan the treatment plan for this person? So I listen to the person, I say, okay, culturally approaching this is how they do it. If this person is really, really into the cultural approaches of treatment, this is how we can match the working culture to make sure this person has a better treatment.
Excellent.
So with that said, we should advocate for ourselves, the family advocate for our loved ones who are sick, and the community as a whole to advocate. And how do you advocate? Because you accept the situation, you understand the situation, you learn more about the situation, and you ask questions about the situation. You are versed with the situation, and you could actually talk on behalf of the person to be able to have a healthy treatment or a healthy treatment plan or a process of managing this condition to be at the baseline.
Dr. Vera, you have something to say.
Yeah, I was going to say, thank you for highlighting the advocacy. So something I also see even with patients that I see, and with, thank you patients for bringing it up too, is the fact that some providers don't listen. And something as Africans or just being a patient, we feel that we can only listen to this one provider, right? What this doctor is saying, this is the only way, and I have to listen to them. But in reality, you can get a second opinion.
Yes.
You tell this provider, I don't like the way you're treating me. I don't like your approach, and request for a different doctor, request for a different provider, request for someone who you think may listen to you. It can be one or two different providers, but don't feel like you have to only stick to this one provider, because that's part of advocating for yourself. And a lot of people will tend to prescribe the way that they know, and they will treat people the same way. But once they will have a different approach. And this is kind of with the whole mental health, even with just finding doctors. Sometimes you meet different doctors and they don't connect with you. You don't connect with them. You don't feel like they're the best fit. So that's where you advocate and ask for someone else. And I see this happen a lot because I see that we feel like we have to stick with one provider and we don't get a second opinion. A part of advocating is finding someone who's a good fit for you and you're a good fit for them. that too as well.
Wow.
Yeah, and to add to that too is that the system in the Western world system in care is not the same like in Africa or in Cameroon, in the sense that you go meet a primary care doctor who is the one and whole person that you meet for everything.
Mm-hmm.
But in the Western world,
You have a variety of them.
Yeah, you have a variety for everything that you need to do.
Mm-hmm.
For example, if you have like patient had the breakdown in psychosis and probably have some nutrition problem, or probably even have like she gained a lot of weight and all the stuff, one person will not see her. There'll be a primary care doctor who manages the whole situation, but there will be specialists that they will send you to be able to go. So you end up having like 10 appointments or 15 appointments in a week. That is just simple how the system is. It's you to prioritize and say, okay, what do I need to manage for my health at this time? And what do I need to do to be able to meet up with the treatment that I have? You prioritize. And that's why the family comes in now.
Well, we appreciate Patience for being here. Her son is autistic, so she's trying to cater for him while being on the show as well. Thank you.
Yeah, sure.
Mm-hmm.
So that's why we bring in the family members now for the support. How are they willing to help you go for all these appointments? How are they willing to help you sit there with you for all these appointments?
Mm-hmm.
So that family support needs to be very, very strong. And I will say it loud and clear here that each and every one of us need that very strong support system to manage our mental illness.
Mm-hmm.
Because if we don't have that strong support system, we'll be overwhelmed and more often we'll break down.
Mm-hmm.
And when you break down, they will not even be there to support you, but they will be there to say, oh, why don't they commit this person? Is always getting sick and getting violent.
Mm-hmm.
But if you were there, like that family member to support, to understand, to take this person to appointments, sure this person is on medication as it is, or to go for psychotherapy, or to go for other appointments that help to manage that holistic person, things will be better.
Mm-hmm.
So I will really plead that we maintain that strong type of family system we have in Africa. Let's bring it here and use it well to support our loved ones when they are managing any condition, including mental illness.
Absolutely. I just love the story you told about the person who was trying to eat and they had so much on their plate and somebody say, hey, all that food for you alone. Because I was reading on the United Nations website about mental health and little things that trigger it, people can just lose the feeling to belong. And that's a trigger. And it's not the best, increased sensitivity, like somebody told Patience, like, why are you so well dressed just to go and eat? Patience, if you can unmute yourself, let me talk to you for a little bit. I follow you on social media and you did say something recently that somebody asked you, if you can unmute yourself, please, Patience. Somebody asked you that, are you sure that everything you're putting on here is your story or are you just trying to get attention from the public? And that she did not like. Tell us about the reactions you get from people on social media when you tell your story. Not everyone.
To be honest, putting out my story out there, I wasn't talking to everyone. I was talking to a particular people, and those are people really suffering with mental illness and don't know how to help themselves. Because I've been there twice where I couldn't help myself. So sharing my story was to make people know that they are not alone and that there is help out there and they can get that help and feel better if they find themselves in worse situations like I found myself.
We understand Patience. She has a kids with her and she's trying to manage both worlds right now, being a mother and also being on Talk to Me Africa. I really admire her for, I don't know how much support she gets when she's in the hospital and your kids are alone. Patience, thank you. Just for
Yeah,
advocating.
right. So this girl, she's not even a friend, she's a childhood acquaintance. And she sent me a message on Facebook all the way from South Africa asking me, oh, can you, and I'm thinking, first of all, I don't just give my numbers unless it's really important. You want to ask me how you can help yourself, a mental health story. And she says, oh, it's very important. And then I'm like, leave me an audio. She says, no, I should call her. And I call her. She's like, oh, this story you're putting on Facebook, is that your story? First of all, I'm surprised. And then I asked her, do people act up such a story? She's like, yeah, this is social media. People can act up. I said, really? She said, yes. And she's like, oh, this could be, this Kumshi. I'm from Mancon. This Kumshi in Bamen, in the village.
What does that mean? Is it witchcraft or?
Witchcraft, yeah, they were trying to call you like, these kids that they say they have 4 eyes. Or maybe they are trying to call me, and there was a girl in South Africa who was experiencing the same. If I refused to respond, I was already pissed off at this point. This story is mine. I've lived these experiences, and you're trying to tell me another story that I don't even relate to. I don't believe in witchcraft. I don't believe in superstition. The only time I'm superstitious is when I'm not autistic, is when I'm psychotic. And that is when I'm ill. On a normal basis, I would never be superstitious. And she goes on to say, oh, because if I don't respond, I'll need to go back to Cameroon for my parents or my family members to talk to me or try to do some traditional rites to set me free. If not, it might lead to death. At this point, I'm like, okay, sorry, I cannot continue this conversation because this is not my line of conversation. I didn't put my story out there for everyone. If you don't believe in my story, it's okay. And believe in what you believe. I'm not talking to you. From your response, it tells me, or your approach tells me, this story is not for you. And so I'll just have to stop the conversation. And that is how I just ended the conversation.
Believe it or not, your story is helping a lot of people already. Your story is what prompted me to record this show today. So you're doing great. Thank you. Dr. Vivian.
And thank you for your story, because we also have, if you go down to the website Naomi, which is the National Association of Mental Illness, you see a lot of stories, life stories of people who are talking about their challenges, their challenges, the way they are managing their mental illness symptoms, the way they are coping, and the way they are functioning. And that's why in America we have what they call peer support specialist. That's a job title that is for people who have experienced mental illness, and now they are there. That job specifically is for them to help others to be able to manage their condition like themselves, and tell others that yes, I've been there and now I am functioning well. So
I think
you are
I should
doing
look
a
for
great
something
job.
like that in the UK.
Yes. You are functioning well, and you are doing well, and you are advocating well. So please continue. And you know that when I put out the story of my sister, they told me, you like a baby in the family, why are you selling the family prestige? So it's not strange to hear from our brothers and sisters about that. And it's not strange to hear from anybody, because they think that it is like a disgrace for a family to have somebody struggling with mental illness. And it's like a disgrace for somebody to be talking about what they are sick about, because they always internalize. When you internalize, the more you get sick. So please talk to somebody. Talk to somebody. Build up that trust to talk to somebody. Patients, go before. Like clinicians, we like mental health providers, we like community people support you. Go before.
And that is one thing that makes Africa lag behind, because we don't share information. We don't share. A lot of time, in my experience living in the United States, somebody's child dies of maybe drug overdose. They put it out there. They go, oh, my child died of this. So I'm bringing it out so I can tell the rest of the community that, hey, take care of your children, listen to them, watch the signs so it doesn't happen. But to us Africans, if that happens, you're like, oh no, it's going to be a taboo. I can't talk about it because I'm going to be stigmatized. My family is going to be stigmatized. But Maflo, thank you so much for having, you started this call for me to talk about mental health. Thank you. And so I have resources, you and Dr. Vivian, to always fall back on. And our patients, my platform is growing as far as mental health talk is concerned. I want to thank you so much for being here today to share your story in such a vulnerable way. We support you. We listen to you. And now you have Maflo and Dr. Vivian to reach out to whenever.
Thank you so much. Yeah, thank you so much for having me. I really do appreciate, and I hope sharing my story goes a long way to help other people who are struggling to manage the situation as well. Because what I say is, the way I tell my story, it sounds very easy. It sounds like it's just like a flip of a finger, but it's not. Because I've been in a place where I couldn't even, I say I go into the shower and pretend and come back. They think I've had a shower, but I've not. So it was in the point where I couldn't even do personal care. So I honestly know what depression, and I've had a friend, December always remind me of my friend who died in 2019 from mental illness, even though they said she died of she became manic, not manic. Is it manic?
Yes.
Where you
manic,
eat,
yeah.
Sorry?
Where you what?
You know when you don't eat and you become very thin or lean.
Oh, anorexic?
Anorexic.
Okay.
Yeah, so she
Anorexic.
became that and she died. But my conversations and the audio notes, I had that. So when I saw people just putting ignorant comments on Facebook, I was depressed. Like, I was really depressed at the time. I couldn't do anything. And I said, the day I become better, I would have to talk about mental illness. And, she's gone, but I'll be there to talk to others and help others, share their story and just make a difference in my own best way, because I'm not hoping to change everyone, because not everyone would ever experience mental illness. And that is the problem, because we all have mental health issues, but not everyone would experience mental illness.
Wow. You're so well said. Yes.
Yeah. Thank you very much.
Thank you. Thank you, everyone.
No, maybe before you go, let me just add this to it. We do have what is called post-traumatic growth, in which that is what patients is experiencing now. So that simply means that your symptoms is at baseline, but you are functioning so well. And actually, is that state of physical and spiritual calmness that you have, despite the fact that you still have stressors in your life, and it's your ability to accept and manage challenges in such a way that it supports that inner peace in you. And again, you embark in that inner peace journey to be able to navigate through life. When you are at that stage in your life where she is now, we call it post-traumatic growth. So most often, when we go to like refugee immigrants, when we go to clinicians or to providers, the first thing they will talk about, that trauma that you experienced, childhood trauma, secondary trauma, historical trauma. But they forget to know that we are at the point where I am now, where patients is at now. It's called post-trauma growth, where we are at that level with that calmness, despite the fact that we have stressors. With that ability to embark in that life, love the life, and that inner support of our spiritual being, that holistic human being we are moving forward, despite the fact that our back has our trauma.
Yeah.
So let's start looking at that growth in anybody. And if that growth is there, there is that inner peace. And if there's that inner peace, we appreciate it and let the family support that with all their might, and the community support with all these resources they have. And this person, in years to come, many, many years, may not even go into crisis, or may not even break down, or may not even experience the mental illness symptom.
We cannot emphasize support enough. Any final words, Dr. Vivian?
Support, yeah.
Yeah, I was going to add to something that was said earlier with that phone call you had with that person. And it just made me think that, each person will have a different level or different degree to how they understand mental illness and how they will go about treatment with it. And what she was talking more is the point of the spiritual things, right? It's the witchcraft, it's demons, right? We see that a lot in community, but that's the level of understanding that some people have, right? And this conversation, what we're having is the goal is to raise awareness and to debunk some of those, those myth and mystical things that are out there so people can get the support that they need. But let's say that you are someone who's going through a mental illness right now and you are receiving that kind of feedback from people in your life. I just want you to know that it is not your fault. It is not their fault either, because that's the degree of where their knowledge
they have. Yeah.
at. Okay. So don't take it upon yourself to try and change their mindset, because you're not going to be able to do that, right? It's like having an argument with someone who can understand your language. Nothing is going to go through. So what you can do for yourself is to recognize their limit is right here, and that's okay. And you go and get the support where you need. If it's not with family, there are, and let's say in the US, there's community resources, there's the peer support, there are armed support workers who can help you go to appointments, help you schedule things if you're not able to do that for yourself at that time. And always know that you can find a provider who fits your need. You don't have to be stuck with one provider. There are people who listen, there are people who genuinely want to care and support on this journey. And I enjoy mental health, and I enjoy being able to come up with a plan with my patients together, because they know themselves the best. I always say, as a patient, you know yourself the best. So find a provider who is able to give that for you and support you on your journey. And when we talked about the triggers, there will be triggers, right? So get into therapy so that you can start identifying what those triggers are, so that it does not, keep reoccurring in the same way. And we are here for you. I always love to connect with anybody who has any further questions. So thank you again for having me on, and I appreciate it. It's nice meeting you too again, patients.
Thank you. Thank you, everyone.
You know what? Thank you so much. I want to say this is not going to be the last time we talk about mental health. It's something that is in our communities. And as long as it is there, we have to help those who are challenged by the illness to manage it. And we also have to support them in our families, in our communities, and why not the world as a whole. Thank you so much. Marflo, thank you. Dr. Vivian, thank you. Patients, thank you.
Thank you so much for having me.
Talk to me, Africa. Talk to me, Africa. Talk to me, Africa.